Thank you very much, Madam Vice President and the Deputy High Commissioner. Let me first allow me to express our sincere gratitude for inviting WHO to this important discussion. It's a pleasure and an honor to be with you here today. And Marie-Reine, thank you very much for that question, because you really highlighted that universal health coverage, or UHC for short, is one of the fundamental pillars of social protection. UHC means that all people, including children and their families, must be guaranteed access to the full range of quality health services that they need, when and where they need them, while ensuring that the use of these services does not expose them to financial hardship. And I think Marie-Reine has just highlighted a couple of those points. We know that guaranteeing UHC is critical in ensuring that children and their families can enjoy their right to access to appropriate healthcare services supported by available and accessible facilities, affordable medicines, and health promotion and preventing programs regardless of their financial circumstances, and without being pushed into poverty due to the out-of-pocket cost of necessary health services and treatments. Yet rates of universal health coverage remain unacceptably low. Some 4.5 billion people, which is more than half the world's population, and thus many children and adolescents, are not fully covered by essential health services. We also know that the proportion of the population facing catastrophic levels of out-of-pocket health spending has steadily increased from 9.6% in 2000 to 13.5% in 2019, when it surpassed 1 billion people. And overall today, some 2 billion people are faced with financial hardship due to health costs. Further, widespread inequalities in health coverage persist, both between and within countries, with greater unmet health needs amongst populations with lower income and lower educational levels, and those living in rural areas. As always, children and families in situations of increased vulnerability, such as those with disabilities, those living in poverty, those impacted by conflict, or in migrant, refugee or displaced populations, carry the heaviest burden. The gap and inequities in inclusive social protection systems, including universal health coverage, are therefore undermining children's health and well-being, preventing the fulfillment of children's rights, and compromising progress towards the 2030 Sustainable Development Goals. An example is under-5 mortality. Despite the progress that has been made to date, some 5 million children under the age of 5 continue to die each year, largely from illnesses which could be prevented or which are treatable if children and families were able to access the health services they need. This is unacceptable. Any effort to improve inclusive social protection for children must include strategies to ensure all children and their caregivers can access affordable and high-quality health care when they need it. But where do we start? First, by reorienting health systems using a primary healthcare approach firmly grounded in human rights standards and obligations. PHC, or primary healthcare, is the most inclusive, equitable, cost-effective and efficient approach to enhance people's physical and mental health well-being. It enables universal integrated access to health services as close as possible to children's and families' everyday environments, and it helps deliver the full range of services and products that children and families need for their health and well-being, thereby improving health coverage and financial protection. Second, we must reinforce a holistic focus on children's and adolescents' health and well-being through a robust, multi-sectoral approach. This requires recognition of the broader social, economic, environmental, commercial, and cultural determinants of child and adolescent health and well-being, beyond merely the absence of disease or infirmity, and an understanding that action is needed across all sectors to address these broader determinants. But progress across all these domains of children's health and well-being will not happen unless we recognize that whole-of-government and whole-of-society engagement and action, supported by the UN and other international stakeholders, is needed to build enabling environments for children and adolescents to survive and thrive. WHO and other partners, WHO, UNICEF and other partners are working to support member states in adopting more holistic approaches to child and adolescent health and well-being, from strengthening their legal and policy environments to improving equitable access to integrated quality services while addressing financial protection. Finally, we must ensure that we are meaningfully engaging children and adolescents as we design, implement, monitor and evaluate social protection systems, including universal health coverage systems. This meaningful engagement is critical to ensure children's lived experiences, needs and solutions can be reflected accurately, and that the design and implementation of social protection systems reaches all children, including the most vulnerable. It is through these actions and more, as so well expressed by my fellow panelists, that we will be able to construct truly inclusive social protection systems that holistically support children's health and well-being, are firmly grounded in human rights standards and obligations, and leave no child behind. Thank you very much.